Hi, I'm Sheila Mahoney. I am providing this presentation on risk as it's applied in the pharmaceutical industry. This is a recreation of a presentation that I gave to the DIA Regulatory and Clinical Operations Excellence Conference in Barcelona in November of 2018. Essentially, this is an exploration of risk as it is experienced in life sciences R&D, and it is directed towards professionals in this space who have spent their entire careers dedicated to total quality management. At this point, the agencies are calling all of us to take a risk-based approach to just about everything, but that can be very disconcerting for people who have spent very long careers dedicated to total quality management. The reason why I chose this as a topic is that the psychology of risk and how that informs decision making and how that impacts operations is an area that I had noticed was less spoken to. So that's what this presentation is meant to do, is to explore risk as a psychological concept and look at how it cognitively impacts decision making and operations. The goals for this presentation is to discuss risk, and risk goes hand in hand with the concept of uncertainty, because when an outcome is certain, there is little or no risk. But risk enters into the equation when an outcome is uncertain. When the future is uncertain, that is where risk starts to play more and more of a role. We're going to talk about the perceptions of risk. So I'm sure you've heard perception is 9/10 of reality. It's probably even more than that. There are a couple of different ways that risk expresses itself in any project, and that's on an individual basis, like what one's own feeling of risk is and how that impacts decision making, but also at the organizational level. And then we're going to talk about how can we combat, once we have some clarity about becoming aware of risk and whether it's perceived or real and some of the dynamics that goes into that, how can we combat the uncertainty? How can we get clarity? How can we start to quantify this? And how can we generate some actual evidence? And we'll get into that. This entire presentation is being put in the context of records management. I am going to talk about the profile of a records manager. So what is the type of personality? And again, this can apply in many different areas. Many scientific and technical folks have very similar personality profiles, but in this way, a records manager is typically extremely meticulous, especially about records, and it plays the guardian role for a drug sponsor's records. And in the pharmaceutical industry, everybody knows that no matter how much money is spent on developing a drug product, no matter how many trials you run, how many patients you're able to collect data for, no matter what, if it hasn't been documented, it didn't happen. And if you can't produce those documents in an adequate and quality way during an inspection, then it really didn't happen. So records, although the day-to-day might be filing and folderizing and indexing and so on and so forth, it really is a critical function for a drug sponsor. And so here we have the records manager thinking about being meticulous and thinking about having to produce all those records. And it's not just one file or one document that a records manager is thinking about. It's really the entire program and the entire life and history of that drug, like the medical record, if you will, of the drug product. It feels like it's on the records manager's shoulder. So when a records manager is facing an inspector, that's what they're thinking and feeling, is that it's the weight of this $2.6 billion that they are trying to be the guardian of. The FDA is looking, the EMA, and I believe that is the Spanish icon. I forget what the acronym is right now, but we were in Spain, so I put that in there. And they're all looking for that records manager to produce the documents with a great degree of quality. And then also, this is the icon I chose for management, is also looking. So what this slide is doing is really speaking to the stress level, which is another way of saying the risk associated with issues with quality that a records manager is facing. And here's a problem with records management. All of those records that were in that previous slide are produced throughout an organization, throughout the vendors that the organization uses, across thousands of people, across many, many years. And in many cases, that records manager doesn't have direct contact with those folks. And all of those folks are most likely not anywhere close to as meticulous as being a records manager would be. As important as it usually is an underfunded budgetary department. I know everybody feels that way, but records management usually is not the top of the heap when it comes to pharmaceutical operational budgets. And there's a feeling of it being underempowered as well, almost like an afterthought. So it's not the group that has the most political capital in the C-suite. These are the questions that are going through a records manager's head when worrying about uncertainty. What happens if a document is missing during an audit? Who is going to be blamed for that? It's not going to be the person who produced it 10 years ago. It's going to be the records manager who didn't get it ready for the inspection, most likely. There could be new regulations in this global environment. There's a tremendous number. It's not just the US that we need to comply with regulations-wise. Maybe it's okay in the US to destroy a document, but maybe in Uganda it's not. And perhaps Uganda is a critical market for this drug sponsor. So there's a huge number of regulations, and there's always a feeling of uncertainty about really understanding, there could be a regulation that we're not aware of, regardless of the amount of efforts to become aware of those regulations. The inspector could have a different interpretation of the regulations. It does happen. And, this idea of being underfunded and underempowered and so forth makes it very difficult to force or encourage or impose better compliance of records management policies throughout the organization. And the name of this presentation was Sisyphus's Rock. And Sisyphus, as you know, was doomed for eternity. I forget what he did to Zeus, but he was doomed to roll a rock uphill, a boulder uphill, only to wake up the next morning and have to roll it uphill again the next day, and he was doomed to that for eternity. And there is no better metaphor for a records manager at a drug sponsor than that. So that was the individual uncertainty and how that seems to increase the feeling of risk. At the organizational level, management is also looking at all this. It's not that management doesn't care, it's just that management has many different departments to service and apply budget to. And in a sense, management's job is really to spend, among other things, is to spend the money that it has in order to run the business, run the engine of the business. And where do they allocate that budget? How do they make those decisions in a way that's going to be the most efficient, that's going to place the best bets to return the highest profits later on down the road? I'm sure this is what it feels like, is every department is a bunch of chicks just asking, chirping for more and more budget, and records management is there on the bottom. Some of the questions that management then feels that generates uncertainty in management is trying to figure out which one is more important, which risks we really need to apply additional budget to, and where does records management fall in there? What's the minimum amount we can get away with spending and still meet our goals? Unfortunately, that's a reality of business. That is true. And again, what decision is going to lead to the maximum profit in the shortest time period? This is really what generates management's uncertainty. And what this translates to is trade-offs. Management is constantly thinking in terms of trade-offs and really needs to put all of those decisions in highly quantified and budgetary ways as much as possible. When someone's trying to take a total quality approach to records management, what management actually hears, and just quality for the sake of quality because we just have to try as hard as we possibly can, and have that be sort of an open-ended, unquantified, disconnected to any sort of revenue stream, it becomes very difficult for management to judge what the trade-off is. And what they end up hearing is simply birds chirping. So lastly, what that feels, and the last component, I believe here on this slide, that records management feels is then not understood by management. So all of these things are contributing to a records manager's feeling of uncertainty, which then generates a feeling of risk, high risk. So how do we combat uncertainty? The biggest tool in the toolbox against uncertainty is achieving clarity. Really getting a very good understanding of what exactly the risks truly are, not just the feeling of risk and trying to take it out of an emotional, basically an emotional thing and putting it into quantifiable terms. And the best way to quantify anything is to use math. And so with respect to the rest of this discussion, what we're borrowing from are discussions of risk that actually have history of about, I don't know, several hundred years, in the sense that risk itself is a concept that pretty much is the cornerstone of financial markets everywhere, meaning that it is an intangible concept that financial markets figured out several hundred years ago how to quantify. And that's what this slide is all about, is how can we borrow from some of those learnings and perhaps apply it to our situation in life sciences R&D in various capacities, and basically quantify what was previously unquantifiable. So this is the equation. It is the E equals MC squared equivalent for financial markets and economics, in the sense that this is how risk is generally quantified. I mean, there's a million different more specific ways it's done, but in general, this is basically it. This runs all capital markets. R equals risk. And sigma is the combination for every outcome, every event, and every outcome, multiplied by the probability of an event, which is also multiplied by the probability of an outcome given that event, and multiplied by the value of that event and outcome pair. So value is where you would plug in revenue stream, or what is the potential revenue of that would be impacted by a unfortunate inspection. And the probability, here's where the issue is, I think, in our space, especially with respect to records management, coming up with verifiable and peer reviewable numbers for the probability of an event, the probability of a bad inspection. We don't really have enough access to what happens across the board with other inspections. I mean, it is a competitive place, competitive market. So we don't share with each other. Drug sponsors are bad inspection outcomes if we can help it. And so I think the industry has a little bit of work to do. I'm not suggesting that we're ready with data right now to do something like this. This presentation was more to get people thinking about what could possibly happen. There's another concept to really think about, and that is the idea of the black swan. The concept is that the black swan does occur in nature, but a very specific set of circumstances has to happen in order to allow for a black swan to happen. And yet, when you do see or experience a black swan, it's so significant, it feels as though it can happen again, or it feels more likely than it actually is. And so the idea here is that the black swan represents the worst possible outcome. And the thinking is, when you're in that emotional state, before getting clarity and before being able to use any sort of evidence or data, you're subject to all of these things that are magnifying the amplitude of the uncertainty that you're already feeling. And then you're thinking about the black swan, like on top of everything else, all of this stress, all of this uncertainty, all of these things that I can't contain in boxes and get certainty around because they're largely out of my control. On top of that, the worst case scenario is this black swan. And before you know it, because you don't have clarity and because the uncertainty is so great, it essentially makes a black swan seem like it's a lot more likely to happen. And that's the problem that affects decision making, is before you know it, budget dollars are being spent trying to prevent a black swan, which had a very low probability of actually happening in the first place. So with that, I'll go into the example, the empirical example that I had. This is a drug sponsor. This is actually public record, so I was able to share it. It's a situation where in 2016, FDA was inspecting a manufacturing site and literally found evidence that this manufacturing site was in the back alley destroying GCP records. And they essentially asked to see the security video of these security cameras and so forth, and it caught a recording of a shredder in the back alley with the stacks of documents, which they then threw into the dumpster. The truth is stranger than fiction sometimes. It was so shocking. Like, this would never happen, and yet it did. As a records management professional and a clinical operations subject matter expert, I have never experienced anything like that in over 20 years. And as I've said, I've worked with many different drug sponsors, and nothing like that has ever even close to happen. The point is that this was a worst case scenario. And I was making the point to then walk through the audience what exactly happened as a result of this horrible violation on the part of this drug sponsor. And essentially, so this you would think is a black swan. The worst case scenario, the hammer is going to come down in the worst imaginable way through all of those things that we were thinking and feeling as I was describing earlier. Well, what actually ended up happening is that FDA issued a warning letter. The drug sponsor hired a very good lawyer who argued that there was no way on that closed circuit TV that FDA could prove that those were actually GCP records because the resolution wasn't high enough. There were various other arguments, and FDA came back 6 months later. The sponsor was able to reproduce or produce all of the records that FDA asked for. It was a very successful inspection, and guess what? There was absolutely no interruption to the revenue stream. The result was not an immediate yanking of the product off the shelves. FDA did give the sponsor ample opportunity to remedy the issue. So that is something I think when the uncertainty level is high, the risk perception is extremely high, and there's fear of the black swan around every corner. And we all know that feeling does, because we deal with medicines that are being given to humans, I think we all do feel that feeling, and that's probably appropriate throughout this industry. But I think what I'm saying is it should be kept in perspective, because nor do we want to waste budgetary dollars where it shouldn't be spent if perhaps we could mitigate the fear factor in some of our decision making. The goal is to have a mature operational relationship with risk. That's the whole point of this presentation, is to point out what work we have to do from a cognitive standpoint or psychological standpoint to make ourselves as very meticulous life sciences R&D experts, to make ourselves more comfortable with risk as a concept. And it's a very challenging thing. And here we are, Sisyphus finally got his rock up at the top of the hill, and hopefully he's going home for a very nice rest. So I hope you did enjoy this and got something out of it. And thank you for watching.